How's the royal family? I pray that everyone is doing well. Well, my royal family, that's one of these videos. Yeah. Go get your shit. Go get your shit. Because I'm about to drag this coon. Oh, wait. I'm about to drag his ass. It's going to be real juicy. Boy. So, my royal family, I know some of y'all know about this, but, I got to put my touch on it, expose this coon for more. And I have 2 articles. I'm not going to read the complete articles. There's things that I'm going to pull out for the royal family and just do this presentation. So while, y'all getting y'all shit, don't worry. I have to go run and go do what you have to do. You're not going to miss anything. I'm going to drag it a little taste and we're going to get to know him. But, at the very end, it's going to be the juiciness. And I got a bonus video, my royal family. I ain't showed a bonus video in a minute. So, Surgeon General Jerome Adams, straight up coon. Many people don't know about him. So, we're going to get to know him. We're going to see how he get down and all of that. So, first thing. So, I want to put some things on your frontal lobe that this is him and his wife. I don't want you to lose sight of anything. They've been together since high school. Yes, he did marry Miss Piggy, and then I guess once he got some coins, he sent Miss Piggy to the fat farm, and they slice and they dice. She don't have that nose no more. She don't have that face no more. She got a new everything. So the extra skin is all up in the back of that head, under all that hair. So this dude don't like himself. So y'all know that. And let's go over here to Michi Alcindor. This beautiful queen here. Here is her husband and her Nathan. So we got it all set up. So I went into y'all to listen to this because I think this is absolutely necessary. And then after that, we're going to get into these articles a little taste. Let's bring this back. All right, here we go.
Brings us to Dr. Jerome Adams, the U.S. Surgeon General. Dr. Adams, good morning. It's good to see you again, sir.
Good morning, Savannah.
Let me start by asking you about what Tom Costello just reported. The New York Times is saying it has looked and seen a memo dated January 29th in which a top trade advisor at the White House warned that trillions of dollars could be at risk and millions of Americans could be at risk because of coronavirus. Did you ever see that letter? Were you aware of that letter? And more broadly speaking, do you believe the White House at its most senior levels had sufficient warning of this pandemic potential?
Well, to answer your question, I never saw that letter, but you and I have talked about the fact that I ran a state health department for 3 years. I've been in public health for 20 years. We've been saying for decades that this is a possibility, but when you look at SARS, when you look at MERS, when you look at the situations we've dealt with, many people at all levels just did not expect something like this to happen at this magnitude. And so there are many lessons learned. This virus has humbled many of us, and I think at the federal, state, and local level, we will backtrack and we will try to figure out how we can improve moving forward.
It's interesting, though, that you just said that, because you just said, it kind of took people by surprise. But I guess that's the point of this memo being reported by the New York Times in January of this year, January 29th. It said particularly that this could put millions of Americans at risk, coronavirus in particular. Do you believe the White House had that sufficient warning to know how bad this could be?
Well, what I know based on my interactions with the task force, and remember I joined the task force later, was that there were preparations going on the entire time. I can tell you from within HHS that Secretary Azar, from the time this started to develop in China, was looking at the stockpile, was trying to come up with plans. And so there was work going on behind the scenes. But again, this virus has humbled many of us. And what I'm focused on now is helping the American people understand what they can do moving forward to protect themselves. And that's why we're leaning into these 30 days to slow the spread guidelines that we've been put out. Because the good news, Savannah, is that we are seeing many places across the country level out their hospitalizations, their ICU admissions, their death rates. We know mitigation works. And so I want people to focus on what we need to do in these next 2 weeks to really flatten the curve and slow death rates.
Yeah, I wanted to ask you about that because you said many places, but New York in particular has real glimmers of hope. Intubations down, hospital admissions down, ICU admissions down. Do you believe New York has hit the peak and flattened the curve?
Well, I don't want to say that they've hit their peak yet, because sometimes places will come down for a little bit and then pop back up again. But I know Washington, California, kudos to the public health professionals out there who have flattened their curve, definitely. And New York, we see that because people have been cooperating. Remember, Savannah, the power to change the trajectory of this epidemic really lies in the hands of the American people. This virus spreads person to person, and the way we combat it is with each and every person deciding to create maximal distance between each other. And the people in New York are doing that. I know that I helped America understand this was going to be a hard and a tough week, but I also wanted them to understand that we've had hard weeks. We've had hard times in our country before, and we've come together, and America is coming together to battle this disease, and we are starting to see progress.
At the same time, you have this Inspector General's report from the administration, from the Health and Human Services Agency, stating that there is still a severe shortage of testing, that hospital workers don't have that personal protective equipment in the numbers they need. They're even not having enough thermometers in some places. Do you acknowledge, sir, that there's woefully inadequate resources right now for many hospitals and frontline healthcare workers, your colleagues?
Well, we know the federal stockpile doesn't have enough in there to deal alone with this type of epidemic. We know that states are responsible for stockpiles, and they were inadequate. We know that hospitals, when you look at hospital preparedness, and I worked with hospitals as a health director, and didn't have enough in there. But we're all working together and trying to move and reallocate those resources. And I can tell you that so far, we are working with governors to make sure people are getting what they need when they need it. And you remember, people called me an alarmist when a few weeks ago I was telling places to pull down elective surgeries. When I was telling people don't take the N95 or medical masks because they aren't helpful for the general public to prevent them from getting coronavirus, but they are needed for healthcare workers. I have told people this was coming, and so now it's important for everyone to do their part and lower demand so that we can move supplies to where they're needed and make sure my colleagues, my healthcare workers, my friends are getting what they need to be able to protect themselves.
A couple quick things. I only have a few seconds left. I know you've got to go. Georgia beaches were reopened by the governor. Good idea or bad idea?
Well, that's the governor's decision, but if you're going to go to the beach, stay 6 feet apart. If you're going to be closer than 6 feet, you can make yourself a homemade mask to protect your neighbor from you being out there. But right now, the best advice I can give everyone is, please, just stay at home. Give us a week, give us 2 weeks.
What about
ideally, give us 30 days, but stay at home.
What about the state of Wisconsin, which is having in-person voting today? The governor there tried actually to delay the election, but it got into a court battle, and the voting will go on today. What do you say about that?
Well, I say as a black man that I know that people have died for the right to vote. This is very important to our entire country. And if people are going to go out there and vote, then please do it as safely as possible. Maintain 6 feet. Please, especially in Wisconsin, consider wearing a cloth facial covering to protect your neighbor. If you're going to exercise your right to vote, do it as safely as possible, and check out my advice at cdc.gov, or figure out how to make a cloth mask from looking at surgeongeneral.gov and seeing how I put this one together.
All right, we will do that. Dr.
All
Adams,
right.
Thank you very much for your time. We really appreciate it.
Well, we know that he has no problem defending his daddy and lying. Trump and them knew about this virus last year. Don't forget the video that I had put up where they had a coronavirus, basically, convention. They had experts that deal with infectious disease. They invited Trump. Trump sent no one there. The Surgeon General was supposed to be there. A whole team was supposed to be there, and based on their predictions, they said possibly worldwide 65 million people could pass. So I wanted y'all to hear more of him and how he get down, and he's your typical coon. So I have an article that I'm going to read from Atlanta Black Star, and this is the title itself. It doesn't work like that, Surgeon General. Blast from asking black folks to check on their mother, stop doing drugs and drinking alcohol during COVID-19 pandemic. U.S. Surgeon General Jerome Adams defended himself after he was accused of making offensive comments during a White House press briefing on Fridays. Adams made the controversial comments about the health disparities communities of colors face as they battle COVID-19 outbreak. He admitted communities of colors were not biologically or genetically predisposed to COVID-19, but they are socially predisposed to coronavirus exposure and have a higher instances of the very disease that put you at risk for severe complications of coronavirus. The Surgeon General urged Black and Latino citizens to avoid intoxication, tobacco, keep in contact with their family members while social distancing. This motherfucker. Whoa! Whoa! Oh, you on one. You on one big time. You know, you wouldn't come to white folks and speak to them like that. So I'm going to skip some parts because I want y'all to actually hear it come out of his mouth. And let's see here. Imagine if the Surgeon General announced a plan to bolster access to mass testing and neighborhood health hubs for Black and Latino people instead of telling us to not smoke and drink, protect Big Mama. Tweeted one critic. How do you blame people for being imperfect victims of a pandemic? Surgeon General Jerome Adams was studying Barack Obama's 100 Ways to be Condescending to Black People. I think he nailed it, wrote another. Okay. PBS News reporter Yamiche Alcindor, while attending Adams' briefing, live tweeting during his remarks, she would ask him about his comments that instant backlash to them within minutes after they were made, saying there are some people online that are already offended by the language and the idea that you're saying behaviors might be leading to this high death rates. Adams doubled down. He doubled down. I'm going to leave it right there. He doubled down on what he was saying. We're going to leave it right there. And then let me read the, pull this up. So I'm on here on Fox News. PBS Yamiche Alcindor mocked for confronting Surgeon General over offensive remarks appealing to the minority community. I'll get into that a little bit later. And so now I'm going to play this next video. And let's see which one I'm supposed to play first. No. That's the bonus one. We're gonna hear what comes out of this coon's mouth. Let me reset this.
Good afternoon, everyone. I started off the week talking about the challenges that lie ahead, and I want to finish the week just by reiterating what you've heard. Mitigation works. It definitively and quantitatively is working, and I want to say thank you to America for your efforts to help flatten the curve and to save lives. But at the President's direction, yesterday I met with 2,000 Hispanic leaders from their communities, and today the Vice President led a phone call that I was on with hundreds of African American leaders, including the Reverend Jesse Jackson, including Derek Johnson of the NAACP, including the National Medical Association and the Black Nurses Association, to talk about
some of the alarming trends we're observing regarding the impact of COVID-19 on communities of color. And you've heard the stats in New York City. Hispanics represent the majority of deaths. In Milwaukee County, blacks are 25% of the population, but almost 50% of the cases and 75% of the deaths. So what's going on? Well, it's alarming, but it's not surprising that people of color have a greater burden of chronic health conditions. African Americans and Native Americans develop high blood pressure at much younger ages. It's less likely to be under control and does greater harm to their organs. Puerto Ricans have higher rates of asthma, and black boys are 3 times as likely to die of asthma as their white counterparts. As a matter of fact, I've been carrying around an inhaler in my pocket for 40 years out of fear of having a fatal asthma attack. And I hope that showing you this inhaler shows little kids with asthma all across the country that they can grow up to be Surgeon General one day. But I more immediately share it so that everyone knows it doesn't matter if you look fit, if you look young, you are still at risk for getting and spreading and dying from coronavirus. The chronic burden of medical ills is likely to make people of color, especially, less resilient to the ravages of COVID-19, and is possibly, in fact likely, that the burden of social ills is also contributing. Social distancing and teleworking we know are critical, and you've heard Dr. Birx and Dr. Fauci talk about how they prevent the spread of coronavirus, yet only 1 in 5 African Americans and 1 in 6 Hispanics has a job that lets them work from home. People of color are more likely to live in densely packed areas and in multi-generational housing situations, which create higher risk for spread of a highly contagious disease like COVID-19. We tell people to wash their hands, but a study showed 30% of the homes on Navajo Nation don't have running water. So how are they going to do that? In summary, people of color experience both more likely exposure to COVID-19 and increased complications from it. But let me be crystal clear. We do not think people of color are biologically or genetically predisposed to get COVID-19. There is nothing inherently wrong with you, but they are socially predisposed to coronavirus exposure and to have a higher incidence of the very diseases that put you at risk for severe complications of coronavirus. But as the Vice President shared on the call this morning, this history, and I want you to hear me say this, it does not have to be our nation's future. We're taking steps now in the midst of the COVID-19 pandemic to reach, protect, and strengthen all communities impacted by this disease, and especially our communities of color. More details will be forthcoming, but we are actively working, as the Vice President and the CDC Director laid out today, data collection, targeted outreach to communities of color, and increasing financial, employment, education, housing, social, and health supports so that everybody has an equal chance to be healthy. And I want to close by saying that while your state and local health departments and those of us in public service are working day and night to help stop the spread of COVID-19 and to protect you regardless of your color, your creed, or your geography, I need you to know you are not helpless. And it's even more important that in communities of color, we adhere to the task force guidelines to slow the spread. Stay at home if possible. If you must go out, maintain 6 feet of distance between you and everyone else, and wear a mask if you're going to be within 6 feet of others. Wash your hands more often than you ever dreamed possible. Avoid alcohol, tobacco, and drugs. And call your friends and family. Check in on your mother. She wants to hear from you right now. And speaking of mothers, we need you to do this, if not for yourself, then for your abuela. Do it for your granddaddy. Do it for your big mama. Do it for your pop-pop. We need you to understand, especially in communities of color, we need you to step up and help stop the spread so that we can protect those who are most vulnerable. This epidemic is a tragedy, but it will be all the more tragic if we fail to recognize and address the disproportionate impact of COVID-19 and an array of other diseases and risk factors on communities of color. The task force and this administration are determined not to let that happen. The president, the vice president has said we will not let that happen. We can't fix these issues overnight, but I promise you we will work with your communities to quickly and meaningfully move the needle in the right direction. Nothing less than the fate of our families and friends. My family and friends depends on it.
All right, my royal family. So, I want everyone to express themselves freely over here on the True Royal Family and True Royal. And I could read in between the lines of the things that he was saying. Like, what got me was multi-generational, like Basically, how I took that was we just living all on top of each other, and you know, when people live on top of each other, on top of that, they nasty, you know, that type of stuff like that. And he did give the impression like the African American community is spreading this. And what pissed me off is, you know, they were right where people like him in the position that he is in, when they get that far, they have already been compromised. That, you know, he's been around for a while, and he's what you would deem safe. This coon right here is safe. He gonna say everything right. You know, you don't have to hold his hand and walk him through anything. He not gonna screw up anything. And see, when they get an opportunity to speak to the African American community, oh, come on, step it up. You know, Obama and his wife would do that kind of stuff. I remember Obama got in some hot water behind that, and when he went over to Nigeria, like all Nigerians run scams and everything, and them people got in his ass. So don't you come over here talking to us like that. You talk down to us and all of that kind of stuff, and you don't clean up your language no more when you talk. But when you're talking around the enemy, exclusively to the enemy in a big room and stuff, you speak with the clean, unquote, diction. That type of bullshit. These people are full of crap. And then they want to jump down this sister's throat because, yeah, it's offensive. Big mama and all of that kind of shit saying that. You know, oh, you got to talk so-called down to us for us to get it. Black folks don't want this shit. I've only been out twice since all of this popped off. And one thing that I observed, the people overall that I did not see covered up was the enemy. And the people that I did see cover up, it was like we was covering up way too much. I mean, folks got on a hat that you could pull over, you know, cover your mouth and nose, then got a mask on top of that, got gloves damn near up to their elbows and all of this kind of stuff like that. Our folks don't want this shit. This shit is scary to our folks in our neighborhoods. And then we already suspicious about things, and we don't ever know what people subject do to us or anything. So yeah, I you know, even though I was fussing about on my last video about conspiracies and stuff, that's why we be concerned, because that kind of stuff has happened to us. Now, I'm not gonna read all of this, and then we're gonna get into this. Bonus video. So, you know, I said that they were mocking. She was being mocked, and there's a key word that the enemy used that I have noticed for a long time. When they see something in real time, and it is clear that it's offensive and that it's extremely racist, it's a word that they use. And let me read this to y'all. PBS White House correspondent Yamiche Alcindor was ridiculed after a bizarre, the word is bizarre, exchange with Surgeon General Jerome Adams over his appeal to the minority groups to stay healthy during the coronavirus outbreak. Let's see here. Recent reports have shown that the virus has disproportionately impacted the Black and Latino communities, particularly in urban areas, while Adams acknowledged at a Friday coronavirus press briefing that didn't have the answer to that. He did list physical traits that are prevalent among minority groups that could have a role with the outbreak, as well as multi-generational housing that could accelerate the spread of the disease. This motherfucker. And then you're gonna tell us don't basically don't smoke no weed, don't drink no alcohol, no tobacco, and all that kind. Call your mama and call your friends. Who the fuck are you? With your monkey ass looking wife. Who the fuck is you? Tell this dude hate himself. I'm telling you something I know. You know? This dude don't like himself. He don't like himself. And then when you get an opportunity to speak to the community, you talk down. You talk down. And then you feel some kind of way because you think you can waltz your ass in our communities and we ain't feeling you. You know, they want to have those options to do that. So let's get into the bonus video. Pay especially a close attention to the last ending of the video.
Developed this over a very short period of time. Please.
Can I ask you also about the African American disparities?
Yes,
I have
sure.
a question for you and a question for the Surgeon General.
Sure.
For you, Mr. President, we know that these health disparities have existed for a long time among African Americans, Latinos, and other people of color. Why did the administration possibly have a plan directed at those communities to prevent high death rates, knowing that the health disparities were there?
Well, we do have a plan, and one of the things I'm most proud about is what I've been able to do for the African American community. The lowest job numbers in the...
What the fuck? I had to stop that. Trump talking about jobs? Are you campaigning, Trump? What are you on, Trump? What the hell do a job have to do with coronavirus, let alone a pandemic? You know, you full of it. You in that coon.
The history of our country. This was...
The virus
yes,
report.
just before the virus came. Well, I'm just saying, because, you know, this has been here for 3 weeks, right? So just before, African American community had the lowest unemployment, the best employment numbers. More African American people and communities have been thriving. If you look at our opportunity zones and what we did, Tim Scott, who's fantastic, a fantastic senator, came to me, opportunity zones, more jobs for African Americans than ever before, better health care than they've ever had before. All of these things. The Surgeon General spoke to it, and he spoke to it, I thought, really brilliantly. I found it very interesting what he said, and I'd love you to come up and answer the second part of the question, because I think you would do it a much better job than I would. Please.
Thank you, Mr. Surgeon General.
Thank you very much.
Thank you. I have a quick question for you. You said that African Americans and Latinos should avoid alcohol, drugs, and tobacco. You also said do it for your abuela, do it for Big Mama, and Pop Pop. There are some people there are some people online that are already offended by that language and the idea that you're saying behaviors might be leading to these high death rates. Could you talk about whether or not could you, I guess, have a response for people who might be offended by the language that you used?
Well, I use that language because that's the language. I've been meeting with the NAACP, with the National Medical Association, with others. I actually talked with Derek Johnson multiple times this week, the head of the NAACP, and we need targeted outreach to the African American community, and I use the language that is used in my family. I have a Puerto Rican brother-in-law. I call my granddaddy granddaddy. I have relatives who call their grandparents Big Mama. So that was not meant to be offensive. That's the language that we use and that I use, and we need to continue to target our outreach to those communities. It is critically important that they understand it's not just about them, and I was very clear about that. It's not just about what you do, but you also are not helpless. We need to do our part at the federal level. We need people to do their parts at the state level, and we need everyone, black, brown, white, whatever color you are, to follow the president's guidelines, the coronavirus guidelines, and do their part. Because when I talked to the NAACP 3 weeks ago, it's important to note that one of the things they asked me was, can you help dispel the myths in this community that people actually can't get coronavirus if they're black? That was a myth that was out there that's actually very important for us to squash here.
And that all Americans avoid tobacco, alcohol, and drug use at this time?
Absolutely. It's especially important for people who are at risk and with comorbidities, but yes, all Americans. So thank you, and I will clarify that. All Americans need to avoid these substances at all times. I put out a smoking cessation report in January. I put out an advisory against youth and pregnant women using marijuana last year, and that was not directed towards any one race. That's everybody needs to do everything they can to be as healthy as possible at this critical time. Dr. Fauci, would you add anything?
Yeah, I think you said it perfectly. Would you like to add anything to it? Because you are really, you expressed it very beautifully before.
No, I mean, Jerome, you did it beautifully. I can't do it any better than that. And I know Jerome personally, and I can just testify that he made no not even a hint of being offensive at all with that comment. I thought that was appropriate. Thanks.
And I can tell you, Jerome has done a fantastic job. Our Surgeon General, I just hope nobody steals him and he goes to one of these big companies for a fortune. Don't leave us, right? Don't leave us, Jerome, please. He's doing a great, you are happy and you're doing a great job. And everybody tells me that too, so we appreciate it.
Yeah, you're doing a great job in cooning, and you're trying to give the impression that the African American community is the one that's not doing their part. That's bullshit. That's bullshit. In life, you're going to see all races of people that reject things and do negative things. But to disproportionately shove that and put that on our lap, you got us fucked up. Yes, it's quite offensive. You wasn't being professional when you spoke. All that mama and papa and all that bullshit. That's not professional. You supposed to, when you are at work, there's a way that you conduct yourself according to your profession. But see, people like him, he hate himself. And when he get a chance to speak to black folks, he want to, swell all up and think he going to wag his finger and speak crazy to us. We're tired of that shit. Black folks don't want this stuff. Don't want this stuff at all. This stuff ain't nothing to play with. We taking this stuff real serious. Over here on the True Royal Family, we take this stuff real serious. You should see all the emails I get behind the scenes. All the links that I got to send out. Because people don't want, they want to keep their immune system up and stuff. We don't want to be compromised in this situation. Who wants to die a horrible death with this type of stuff? But you're going to have your fools, but just to sit up here and point this out. But I'm going to tell you something. I guarantee y'all. I guarantee you this. They salivating for the summer where people going to hit the beaches, and we're going to see all of that. People going to get out and mingle and do all of that. And, we're going to see how the rest of this year play out, and watch how folks, you're going to see pockets throughout the world, basically. But we're just going to focus here, just dying in droves because they did not take heed. Did not take heed. Don't listen to them people up there. When I was working in the world of construction, there's some jobs that I worked on, they didn't really take safety serious. We would have a safety meeting. They just want you to sign the damn paper. And real quick, I learned I better come up with my own safety program. And that's what we have to do. We got to do what we have to do individually to protect our immediate situation. I've been talking about our immediate situation for a long time, my royal family. Protect your entire family. Do what you got to do. Only collectively deal with the people in your household. You can't worry about nobody else. And make this an ongoing conversation. Not, okay, I got everything to protect myself. No, ongoing. Make sure your family doing what they have to do. Because that's all we talk about in this house. We take this stuff real serious. Anybody that want a link from me, a list of things that I could give you to protect yourself, this is not my formula at all. This is something that our Father grow up out of the ground. I can send you those links and stuff. This is not my formula. Again, I do not give out toilet paper and all those type of things like that. My royal family, I really need y'all to listen to me. Because some of y'all is not listening to me. And I'm taking some offense to some extent that I'm bleeding my heart out, and I'll hear somebody email me with some opposite shit. Listen to me or don't listen to me. And when you don't listen to me, don't contact me. All right? I don't have a formula that I have made up, but I'm studying right along like everybody else to see what can we take to build up our immune system. Don't ask me to put no damn links out so the enemy and their supporters can go run with it. They have to do their own damn research. Now that's the thing that I will say. We have to do our part amongst ourselves. Be inclusive with ourselves. To hell with him and how these other people speaking, but don't come over here wasting my time, because I damn sure ain't gonna waste your time and telling me silly shit, because I ain't gonna sit up here and tell you silly shit. I can't make you no guarantees, but one thing that I can tell you is I know what can keep your immune system built up. That I do know. And there's things that you know, and we need you to share it. But I am not allowed on this channel to put any links out like that, because a lot of y'all don't want me to make it easy for the enemy and the enemy supporters. So anyway, whew. Forgive me, my family, if I'm coming off offensive of anything. This shit is stressful. You know, this is a new way. The world will never be the same again. I'm happy that things are changing, but it's an adjustment. That's all it is. It's an adjustment. So sometimes we'll get a little bit heated, but from the depths of my soul, I don't want my family sick. I don't want to hear about our royals dropping or anything like that. I'll tell you one last story before I get off here. One of my girlfriends, she works in a daycare center. And the daycare center is predominantly Asians. And she works in the infant department. And back in February, she said the babies was getting quite sick. And she said all of them, the majority of them had high fevers. They didn't indicate like they had colds or anything. And in her daycare alone, they had to send 12 babies home. And she said the 5 that was there, they was on their way out too. And she was trying to figure out what the hell is going on. Why is these babies sick like this? You know, I never seen this. You know, they're not demonstrating a cold or a flu, but they weak, they lethargic, and got a high temperature. And when they finally, did the whole lockdown and everything, she said, I'll be damned, them babies had it. And again, the majority of them in her daycare are Asians. That was quite enlightening, my royal family. So one more thing that I wanted to say before I get off of here. Anybody that's in the medical field on the True Royal Family, I would like to get a group of y'all, a panel of y'all, where we can get together and talk and let us know y'all experiences, things that can help us or anything. Anybody out there in the medical field, and it don't matter, don't be looking at yourself, well, I'm in the medical field, but my position ain't all that great. Your position is great. So anybody that's in that medical field, contact me. As I'm speaking, you see that I'm putting my email in the comment section during this premiere on the True Royal Family and True Royal. I like to get a group of folks that I can interview or on my channel, or possibly me and Lisa Cabero could interview, because we ain't did one in a minute. Me and Lisa Cabero got a channel called Cabero Santana where we can do interviews over there. But I would like to do not just one, a series of interviews and things that y'all can help us with, because y'all out there on the front line in this war and everything. But anybody that's in the medical field, contact me, and if you're willing to be interviewed, and we like to hear the core truth. It ain't gonna be no cut. I want to hear from y'all. So please, would y'all do that? Anybody that know anybody, you don't necessarily have to be a sub to this channel. Anybody that in your family that's in the medical field or anything like that, see if they're willing to do an interview. So anyway, my royal family, thank you as always. Render your voice with your beautiful divine words. And as always, my royal family, I thank you for your love. I thank you for your support. And with that said, Ashe.